Hello, this is Dr. David Green, CEO of the Nevada Pain Network, where we bring you anything and everything educational for pain management. Today the topic is the basics of platelet-rich plasma therapy, known as PRP therapy for short. It's a very exciting procedure as it uses one's own growth factors, platelets, and stem cells to regenerate damaged tissue. Previously, it's been used for decades in dentistry, urology, ophthalmology, cardiovascular procedures, and other fields, and recently it's becoming much more popular in musculoskeletal medicine. And the basic definition is a volume of plasma that has a platelet count and concentration above the baseline of whole blood. Regenerative medicine has been breaking the mold of conventional treatments. Traditionally, you have cortisone, which works very well for pain management, but it doesn't regenerate any of damaged tissue. Traditional treatments therefore offer the proverbial Band-Aid, whereas regenerative medicine treatments like PRP therapy, they can help actually heal the damaged tissue. What are the indications for PRP? Well, they're fairly broad now. You have tendonitis conditions such as tennis elbow, rotator cuff tendonitis, arthritis conditions such as degenerative knee arthritis, shoulder, hip. Then you have ligament injury such as medial collateral ligament, partially torn ACL, and things like that. Athletes are using PRP like crazy. You have people like Tiger Woods who've had the procedure, Rafael Nadal. On the right, you can see Kobe Bryant's had it a few times. Then you have plenty of the Los Angeles Dodgers, a couple of the pitchers, a few of the outfielders, and then people like Brandon Roy have resurrected their career with PRP. Well, how is it performed? It's actually a fairly basic type procedure. I mean, it's a simple blood draw in the office of about 30 to 60 cc's, and then it's spun in a centrifuge very rapidly for about 15 minutes. And then what you end up with is 3 layers. You have a platelet-poor plasma layer on top, a platelet-rich plasma layer in the middle, and then a red blood cells on the bottom. So it's the middle layer. You end up with about 5 cc's or so, and that gets injected in the same procedure into the shoulder or wherever it's going to go. Okay. Usually doctors will use ultrasound guidance or fluoroscopy for the best accuracy. Now, what PRP therapy does is it promotes inflammation. Inflammation is the first stage of healing, and therefore you should take anti-inflammatories before or right afterwards. Okay. Now, what it also does is it calls in the body's own stem cells. It's what's called a chemoattractant for stem cells. So that's why it's often called a stem cell therapy. Professional sports leagues have not banned the use of PRP therapy. Initially, the World Anti-Doping Association did ban it, but they reversed that, basically stating that there was a lack of any current evidence concerning the use of these methods for purposes of performance enhancement. Well, what are the outcomes? There have been some small studies. This was a knee study in 22 patients in the Clinical Journal of Sports Medicine. They looked at multiple MRI scans over a period of a year, and they found that over 80% did not have any evidence of knee arthritis progression during that time. And with only one PRP injection of the knee, pain scores decreased significantly. Functional and clinical scores increased at both 6 months and 1 year. There are quite a few basic studies showing that PRP treatment may improve healing in many tissues, but there are no large-scale clinical studies as of yet. There was a smaller study looking at tennis elbow out of South Florida in 30 patients, and these were patients who had tried everything except surgery. 28 of them were able to obtain pain relief and avoid surgery altogether. More studies are needed to prove the effectiveness of PRP treatment conclusively and to research the best ways to standardize the treatment preparation. The risk-benefit ratio, it's your own blood, so the risks are very low. It's an outpatient procedure. You may get increased pain for 48 hours because of the inflammation. Oftentimes it takes a series of 2 to 3 injections over a few months. It's not covered by insurance right now, so there is some out-of-pocket cost. And small studies show excellent outcomes with minimal downside. I mean, there's a tiny risk of infection. The top pain management clinics in Nevada are in the Nevada Pain Network. They offer a one-stop shop with board-certified pain doctors, chiropractors, acupuncture, spinal decompression therapy, and also physical rehab. There are several locations accepting over 50 insurances. All the doctors are board certified and they've won the Patient's Choice Award 5 years in a row. Call us today for scheduling at 702-323-0553, and the website to visit is painmanagementlasvegas.com. I'm Dr. David Green for the Nevada Pain Network. Your pain stops here.